Afternoon, and my apologies, we have taken some time. So we are here today because we have noted a lot of negligence, laxity, inaction, and impunity. And this especially coming from the county government. We gave our demand notices as from the second day of June this year. And if you do your count up to today, that is more than 60 days since we first raised the issues in question. On the 6th day of July, we gave a 14-day strike notice. In that period between the second day of June and the 6th when we were giving the notice, the county governments had never responded to our concerns. And up to today, more than 60 days after, and almost 30 days of strike, or after we gave the notice, that is, the Council of Governors is yet to even formally invite us for any meaningful discussion. They have decided to talk to us through the media. And I want to thank the Ministry of Health, led by the CS Duale, because when we raised these issues from the 2nd of June, we have had several meetings, and whatever could be done by the Ministry of Health has been done. Our demand for payment of salaries for the month of July was done, and the ministry even went further to convert the pay slips for the UHC workers to permanent and pensionable. But then, we know that for your terms to be permanent and pensionable, it is not only about the pay slip. You must have an accompanying letter that is supposed to be given by the county government. So up to this day, we have no idea whatsoever as to why the counties have refused to do what they are supposed to do, irrespective of the fact that they have already been given 8.9 billion by the parliament to effect PNP status for both the UHC workers as well as the Global Fund staff who are deployed under the TB program. And I think where we have reached, and as we have kept saying, and I think for us we are saying that we are welcoming the conversation that His Excellency the President is saying that Kenyans should have. And at the forefront should actually be the conversation about our health care. It is becoming evident by the day and by the handling of these issues by the Council of Governors that health has become a weight too heavy for the Council of Governors and the counties to bear. And these are not political statements. Our county governments have been unable to hire staff. And that is why in 2020, when we were starting our universal health coverage, and in appreciation of the gap and the staffing shortfalls that we were having, that could not enable us to start off on the universal health coverage program, the national government had to come in, and they had to employ the UHC staff, about 9,500 by then, and deploy them to counties. When COVID-19 struck, if you can remember, the counties could not still be able to handle, and they had to also engage the national government to engage another cohort of contracts under the COVID-19 response, who are still on contract up to date, and then deploy them to counties. So what we are saying is that it is evident, and today we are here to talk to the public because the governors, as is evident, are not listening, do not want to listen, and they simply do not care about the citizen. As we stand here, hospitals are closed across the country, if you have gone round. It's only the doctors who are not on strike. The nurses, the clinic officers, laboratory officers, public health officers are all on strike. And facilities are not working. But yet the governors do not see any problem with it. And that is why we are saying it is a case of negligence, and it's negligence because they have been given a mandate by Kenyans to ensure that Kenyans can be able to access the highest standards of health as envisioned under our Constitution. And we are here to say that the strike action that is ongoing, we are ready. We have been here for 3 months, for 4 months, even if it takes 1 year for the people who have been elected into office to understand their mandates and do right by Kenyans. We as health workers, we also have a duty to ensure that Kenyans are treated by health workers who are adequate and who are motivated enough to be able to see them and to provide the quality of health care that Kenya boasts of. Allow me to invite my colleagues so that they can also give their remarks.